Hello and welcome to the BBS show. My name is Jonathan and I am your regular host on the show. Now, if this is your first time here on this channel, hello and welcome. Glad to see you and glad to be with you once again. Now, consider subscribing to this channel if you want to get more information, education, awareness, and of course, assistance. What we do here is that we create awareness on the dangers that predispose to cancer and how you can avoid this deadly disease. We also provide support to individuals who have been directly or indirectly affected by this dreaded disease called cancer. Now, the BBS show is supported and of course sponsored by the Magdalene Iyamu Cancer Foundation. And of course, if you want to be our sponsor out there, consider our information on the screen and get to meet us. Right now, on our last video we talked about ovarian cancer. We took a critical look at the causes, the risk factors, the diagnosis, and even treatment on ovarian cancer. So make sure you check out that video. And of course, today our focus is on prostate cancer. This is the disease that some men across the globe are battling with. So sit back, relax, as we take on everything you need to know about prostate cancer. I'll be right back. Prostate cancer is the cancer that occurs in the prostate. Okay? The prostate is a small walnut-sized or walnut-shaped gland in males that produces the seminal fluids that nourishes and transports the sperm, the male sperm. Now, prostate cancer is one of the most common types of cancer worldwide, and it occurs only in males or men. Many prostate cancers grow slowly and are confined to the prostate gland, where they may not cause a serious harm. However, while some types of prostate cancer grow slowly and may need minimal or even no treatment, other types are aggressive and can spread very quickly. Okay, prostate cancer that's detected early when it is still confined to the prostate gland has the best chance for successful treatment, and it may cause no signs or even symptoms. This in its early stages. All right. Prostate cancer that's more advanced may cause signs and symptoms such as trouble urinating, when you experience trouble urinating or pains, decreased force in the stream of the urine, the force with which the urine flows out. You can also have some symptoms like blood in the urine, blood in the semen, bone pains, losing weight without trying, and of course erectile dysfunction. Now, if you are a man and you experience the above symptoms that I just highlighted, make an appointment with your doctor as soon as possible and discuss the symptoms that worry you. It might be all of them, it might be one of the list I mentioned. Please, this is very important. You can also reach us via our information which is on the screen. We will be glad to be of service to you, and of course refer you to appropriate medical professionals for further checkups. Okay, don't just be left out in all these things. Now, it is not clear what causes prostate cancer right now in the world. It is not clear. Doctors know that prostate cancer begins when cells in the prostate develop changes in their DNA. Okay, and the cell's DNA contains the instructions that tells the cell what to do. The cell DNA the DNA in all cells in the body. These changes tell the cells to grow and divide more rapidly than normal cells do. The abnormal cells continue living while the good cells continue to die, while the abnormal cells continue to grow. The accumulating abnormal cells form a tumor or a mass that can grow to invade nearby tissues. Now, In time, some abnormal cells can also break away and spread. This process is called metastasis, and it might metastasize to other parts of the body. Factors that increase the risk of prostate cancer include older age. The risk of prostate cancer increases as a man ages. All right, it increases with age. It is most common after the age of 50. So when men are beyond the age of 50, you have to really be conscious of your health. Another factor is race. For reasons not yet determined, black people have a higher risk of prostate cancer than people of other races. In black people, prostate cancer is also more likely to be more aggressive or advanced. We have family history. Now, if a blood relative such as a parent, sibling, child has been diagnosed with prostate cancer, your risk may be increased. Also, if you have a family history of genes that increase the risk of breast cancer, and these genes include the BRCA1 or the BRCA1 or BRCA2 genes, a very strong family history of breast cancer, it increases your risk of prostate cancer. All right, you can check our previous video where we talked about ovarian cancer, and we talked more about the BRCA1 and the BRCA2 genes. In our subsequent videos, we will do a particular video on these genes. Another risk factor is obesity. People who are obese have a higher risk of prostate cancer compared with people who are considered to be healthy in weight. That's within a certain BMI. All right, in obese people, the cancer is more likely to be more aggressive and more likely to return after initial treatment. The complications of prostate cancer and its treatment include cancer that has spread to nearby organs such as the bladder, or the cancer that might have traveled through the bloodstream or the lymphatic system to the bones or other organs. And of course, prostate cancer that spread to the bones can cause pain and of course broken bones. Once prostate cancer has spread to other areas of the body, it may still respond to treatment and may be controlled, but it is unlikely to be cured. That is the unfortunate thing, but you can also control it. We also have both prostate cancer and its treatment can cause urinary incontinence. Treatment for incontinence depends on the type a patient have, the type of prostate cancer that a patient have, and how severe it is, and the likelihood it will improve over time. Treatment options may include medications and surgeries. All right, we also have erectile dysfunction. Erectile dysfunction can result from prostate cancer or its treatment, including surgery, radiation, hormone treatment. So these are the complications that are involved in the treatment of prostate cancer. Now, a patient can reduce the risk of prostate cancer if they choose a healthy diet full of fruits and vegetables. It is very, very important. And of course, eating a variety of fruits and vegetables and whole grains, don't forget that, contains many vitamins and nutrients that can contribute to your overall health. And when you are healthy, you are wealthy. That's what they say. Whether you can prevent prostate cancer through diet has not yet been conclusively proven or proved. But eating a healthy diet with a variety of fruits and vegetables can improve a patient's overall health. So as individuals, we need to choose healthy foods over supplements. All right. Okay, another thing is ways to prevent this thing is to exercise. Always have you have to be fit, right? Exercise improves your overall health. It helps you to maintain weight. It improves your mood. Try to exercise most days of the week. Don't just do sedentary. Don't just be involved in a sedentary lifestyle. Start slow and work your way up to a more active lifestyle each day. Also, you really need to do this. Talk to your doctor about increased risk of prostate cancers, okay? If you have a very high risk of prostate cancer, you and your doctor may consider medications or other treatment options to reduce the risk. It is very, very good to for individuals to talk to medical professionals about their health. Now, on the flip side of the program, we shall be talking about diagnosis and screening. I'll be right back. All right, welcome back. Cancer screening means looking for cancer before it causes any form of symptoms, right? The goal of screening for prostate cancer is to find cancers that may be at a high risk for spreading if not treated, and to find them early before they spread. That is the importance of screening. So it is important for people to go for regular cancer screening. Now, there is no standard test to screen for prostate cancer. The two tests that are commonly used to screen for prostate cancers are the prostate specific antigen test. This is commonly called the PSA test. Now, what is a PSA test? It is a blood test called a prostate specific antigen that measures the level of PSA in the blood. PSA is a substance made by the prostate. The levels of PSA in the blood can be higher in men who have prostate cancers, right? Okay, the PSA level may also be elevated in other conditions that affect the prostate. So this is the blood test to check the PSA level. Okay, now as a general rule, the higher the PSA level in the blood, the more likely a prostate problem is present. Okay, that is just how it works. Although many factors such as age and race can affect a PSA level. Some prostate glands may make more PSA than others. PSA level can also be affected by certain medical procedures, certain medications, an enlarged prostate, a prostate infection. So because many factors can affect the PSA level, okay, the doctor or your medical professional or an oncologist is the best person to interpret a PSA test result. If the PSA test is abnormal, your doctor may recommend a biopsy to find out if you have or if the patient have prostate cancer. Now, the other test is a digital rectal examination normally called the DRE. Digital rectal examination is when a healthcare provider inserts a gloved lubricated finger into the man's rectum to feel the prostate or any other thing that is abnormal, right? That is DRE. Now, talking about the treatment, your prostate cancer treatment options depend on several factors. So the treatment actually depends on the factors that affect the immediate patient, such as how fast the cancer is growing, whether it has spread, and the patient's overall health, as well as the potential benefit or side effects of the treatment, that if a treatment is to be employed. Sometimes immediate treatment may not be necessary. Now, low-grade prostate cancer may not need treatment right away. For some, treatment may never be needed. Instead, doctors sometimes recommend active surveillance. That means they really need to monitor the patient on a quarterly or a biannually basis. Now, nearly everyone diagnosed with cancer experiences some distress at some point. Now, if you are distressed, you may feel sad, angry, or even anxious. You may experience difficulty sleeping, or you find yourself constantly thinking about the health condition or the cancer. Always try to get help from friends, family members, support groups, spiritual leaders, and of course, just anyone around. Just be exposed to get help, or rather be exposed to getting help from anybody. Finally, today, cancer is a devastating disease and it changes any of its victims' course of history, right? Please be vigilant, be health conscious, and of course, be prayerful. Never ever forget that the Almighty God is the ultimate healer and the solution to all of life's challenges. Okay, now that's our program today. Please do not forget to subscribe to our channel, just click the link right below this video and subscribe. Like and share our videos on this channel. We also carry out caregiving within our budget. That is for you to know how we carry out our caregiving and how we support the people. Now, if you know how we can be of help, kindly contact us via our information on the screen. Thank you for watching our video today. Take care of yourself and each other. We love you, and bye for now.